With some very troubling forecasts regarding COVID. Here in Colorado, as of today, more than 1,400 patients are in the hospital, and capacity at those facilities is being pushed to the brink. Now the governor is asking for more federal teams to help with the surge. During the worst of the peak of the pandemic, we had more than 1,800 people in the hospital, but these latest models now say we could top 2,000 or more by the end of the year.
We'll take a closer look at those models in just a moment. First, though, we want to show you how this wave has just taken control and caused serious problems across our state. These are the changes over the last 3 months. During that time, we have seen nearly 200,000 new cases statewide. The number of hospital patients has nearly tripled, going from 500 2 months ago to well over 1,400 today. Late last week, the state's top medical leaders created new models to see how bad the hospital situation could be by the end of November. Now
this latest surge has blown right past those estimates within just a few days. So now there are new forecasts, and they are the most grim that we have seen during the entire pandemic. They say if nothing changes from current trends, our hospitals will see a surge unlike anything we've seen since COVID became a part of our lives. At the end of the year, we could be looking at a peak that has hundreds more people in the hospital than at any time last year. Here is state epidemiologist Rachel Herlihy to walk you through the numbers and the
If we continue to have individuals receive booster doses at the same rate they're receiving booster doses now, the projection is that we would reach a maximum of 2,258 hospitalizations on January 1st. If we are able to double our booster dose uptake in the state, that potentially can decrease the number of maximum hospitalizations down to 2,156. Also brings our peak a little bit sooner on December 24th. And then if we can reach our state goal, which translates to 75% of eligible individuals in the state, and by eligible I mean over the age of 18, receiving a booster dose, you can see that we get down to 2,082 peak hospitalizations on December 20th.
That 2,000 number is important. That is the state's capacity when it comes to hospital beds. Right now, that capacity is already at an all-time low, and now the governor is asking for more help from the federal government. A medical surge team from FEMA arrived this week to help at Parkview Medical Center in Pueblo. Today, Governor Polis says he has requested 2 more of these teams be sent to Colorado. Yesterday, crisis standards of care were reactivated to help with staffing at hospitals across the state. He has already signed orders stopping cosmetic surgeries and has eased restrictions on transferring patients, and more changes are expected soon. State leaders plan to increase hospital capacity by 500 new beds. They are looking at new policies to make indoor events safer, and there's also new executive orders in place when it comes to boosters.
Of course, in the past, the governor has gone as far as to say the FDA had blood on their hands for delays in approving COVID booster shots. Well, today he once again called out the federal government for what he called very convoluted messaging over those boosters.
Frankly, we feel that the CDC and the FDA bungled the messaging on the booster. They made it very complicated. The basic message is if it's been 6 months after Moderna or Pfizer, you should get it. If it's been 2 months after J&J, you should get it. We're going to be issuing an executive order soon that says that Colorado is a high-risk institution. And everyone is eligible in Colorado on the argument that you are part of a high-risk environment by nature of being in Colorado.
Nationwide, more people are starting to notice what is happening here and in our region because things are starting to change in other parts of the country as well. Instead of falling, cases are starting to plateau in other states. And that's what happened here before the surge. But it's unclear if that's going to happen elsewhere. Colorado currently has the 7th worst COVID trends in the nation. We also share a border with 3 other states in the top 10. This is a closer look at the counties across Colorado. Those in red have the most number of cases. Right now, the worst situation is in Pueblo and Mesa counties. Others along the Front Range have also moved from yellow to orange, and you can see how the cases are on the rise.